Year to you all. So happy to deliver the first clinical session of this new year. I warmly welcome everyone who are here. So today my talk is going to be on childhood asthma. So from evidence to everyday practice. So how we are going to engage the latest evidence into our everyday practice. So objectives of these sessions are to define how to define the childhood asthma and to understand its burden, so globally as well as locally, and also how do we diagnose asthma accurately in different age pediatric groups, and how to classify asthma severity and also the level of control, and apply GINA 2025 stepwise treatment in children, and to how to manage acute asthma exacerbation effectively, and most importantly to educate families and children to improve adherence and outcomes. So little something about the GINA. So have you heard about this GINA? So what is GINA? So not only in Sri Lanka, so everywhere in the world, so we follow the GINA guidance in managing asthma, so which is kind of like improve over the 30 years, so which is like improve the morbidity and mortality related to asthma. So GINA stands for Global Initiative for Asthma. So it is it's a kind of like organization which drawn members who are outstanding commitments to asthma researchers and clinically managing asthmas, and also they are highly experienced in managing asthma, not only in one country, it's globally. So all the countries, so the experts and with the latest research evidence. So basically this GINA is formed to educate the healthcare workers who are dealing with managing asthma to given updated management and guide, right. So this GINA basically, so every year, so it's basically it's formed in 1992, and after 3 years is 1995 first published its report, and since then if from 2002 we get annually the GINA strategy report. So each year they analyze the evidence across the country everywhere. So they get the based on the research evidence and then clinical responses, they provide some the strategy report each year. So the latest available is 2025. Right. So what is asthma? So asthma is a heterogeneous disease. So heterogeneous disease in the sense, so it doesn't have only one disease, underlying disease process. So it is it's a heterogeneous. It has multiple underlying disease process going on asthma. So that's why each children or each person with asthma, they manifest differently. They behave differently because there will be there are many underlying disease process going on. Right, and it is ultimate, the ultimate outcome, whatever the disease, underlying disease process, but it is characterized by the chronic airway inflammation. Whatever the disease process, ultimate thing is the chronic airway inflammation. So as a definition, so the clinically they will have co-clinical symptoms. So co-clinical symptoms, mainly the four co-clinical symptoms. So each time when we encounter, if we are thinking of asthma, one is the cough, wheeze, so shortness of breath, and if it is an older child, they can say feeling some chest tightness, and also with the expiratory airflow limitation. We will come later how do we measure this variable expiratory airflow limitation. All these symptoms, it will vary over the time, and also the intensity, severity also will vary. For all these things there should be some, usually there is some triggers. So triggers, it could be an allergen, indoor allergen, outdoor allergen. So indoor allergen in the sense, so any house dust mites, some in our city some cockroaches, some flies, whatever, or even some so indoor some pains. And outdoor allergens, mainly the smokes, right. So if it related to the smoke, it could be active smoking or else passive smoking, and exercise, some viral infections, and change in weather, so itself can cause these symptoms. Right. So why do we, so especially in children, so why childhood asthma matters? So it is so in children, this is one of the most common chronic diseases in children. So because it's a major cause of school absenteeism, and also not only with the increase in hospitalization, emergency visit, it doubles the burden to the family. So not only the person, so the parents should come and accompany. So it additional burden to the family, and also it may cause the disruption to the family. So any child with a poorly controlled asthma, which means it's a kind of like preventable morbidity. So we can't allow any child or child to go into poor control. It's totally preventable. So with the appropriate good care and stepwise management, it should be preventable. Always our aim is to keep with a well controlled asthma. Right? If we go to the prevalence, so global burden, so as you can see in this picture, so you can see so it is a serious global health disease, right? So so in all the country, in Sri Lanka it comes to the kind of like prevalent 2,000 to 4,000 per 100,000 population, but so so as per the latest GINA report, so it affects 1 to 29% of population in the world, right? And also it's a serious mortality as well, so 1,000 deaths per day, so especially in low and middle income countries. So if we take the childhood asthma, so childhood asthma as per so here still it is so apart from this, Sri Lanka comes between 133 to 251 per 100,000 children when we take in the world. So the global prevalence of asthma in children is 10 to 20%, but children in Sri Lanka, that is 9 to 12%. So in Sri Lanka, basically with the limited research studies, only few regions are assessed, basically the Kandy, Anuradhapura and so Colombo area only the studies available. So we don't know so actual geographical variation in Sri Lanka because of the limited research studies, but so based on the studies it's about 9 to 12%, 9 to 12%. If we move to the pathophysiology of asthma, as I discussed before, so it's a chronic airway inflammation. To understand the disease underlying pathophysiology, so basically any allergen or any triggers, right? So when it trigger the airway epithelium, it induces, there are three main cells around it. So one is the lymphocytes, T helper cells, type 2 eosinophilia mast cells. These three cells are major cells that causing these troubles. So when one cell activated, they releases cytokines, right? These cytokines induces other allergy related cells and which releases some immune mediated IgN thing. So when any insult, if there is a chronic and persistent, so there will be with a static triggers, and it will cause repeated injury, repeated inflammation and airway remodeling and causing these symptoms. So by understanding this physiology, when we if we go to the pharmacological treatment, we can understand more what disease, what stage we are acting.